Bonjour à tous. Today, I'd like to discuss the current epidemiology of COVID-19 in Canada and World Hepatitis Day. There have been 114,597 cases of COVID-19 in Canada, including 8,901 deaths. 87% of people have now recovered. Labs across Canada have tested over 3,863,000 people for COVID-19 to date. Over the past week, an average of over 40,600 people were tested daily, with 1% testing positive. Since last Friday, when I introduced the 7-day rolling average for Canada's daily case counts at 487 cases over the period July 15th to 21st, there has been a further increase to an average of 496 cases now being reported daily. As I have said, the upward trend in this indicator of COVID-19 activity is something that we must keep a very close eye on. Local public health authorities are doing their best to rapidly find cases and trace contacts to prevent further spread and investigate where transmission is occurring. Canadians can do their best by limiting their number of social contacts and maintaining physical distancing and hygienic practices that reduce the likelihood of exposure and spreading the virus. Keeping our contacts low ensures that if an exposure occurs, public health authorities will be able to manage the intensive work of testing and tracing to keep spread under control. If we overtax the public health resources and lose this ability to effectively test and trace, well, let's not go there. Switching gears a bit, I want to acknowledge that today is World Hepatitis Day. In Canada, I am pleased to see that rates of hepatitis B are declining. However, I am concerned about the increasing rates of hepatitis C. Despite recent advances in effective hepatitis C treatment, up to 246,000 people in Canada are living with chronic hepatitis C, and approximately 44% of them are unaware they are infected. Dans certaines tranches de la population, en particulier chez les autochtones et les détenus, le risque de subir les ravages de l'hépatite C est démesuré. Les hommes sont davantage à risque d'être infectés, mais le taux d'infection des femmes croît 2 fois plus vite que celui des hommes. Autre fait inquiétant, le nombre d'infections à l'hépatite C augmente chez les 30 à 39 ans et chez les personnes de plus de 60 ans. Certain populations, in particular indigenous populations and prison populations, disproportionately experience the harms caused by hepatitis C. And while men are more likely to be infected compared to women, infection rates are rising twice as quickly among women. Equally worrisome is the rise in hepatitis C infections among people between the ages of 30 to 39 and 60 years and older. People who are at greater risk of hepatitis infection include those who have shared drug use equipment even once, had a tattoo or piercing done with non-sterile equipment, shared personal care items like toothbrushes or razors, been exposed to blood during sexual activity, or were born to a mother with hepatitis C. We know that early diagnosis and treatment of viral hepatitis leads to better outcomes, so we need to continue to address underlying factors, such as stigma and discrimination that prevent people from getting the treatment and ongoing care they need. The COVID-19 pandemic has further compounded access to testing and health-seeking behavior for many. But I cannot stress enough how important it is to maintain health visits for vital health services, including for viral hepatitis. Healthcare providers across the health systems have measures in place to ensure that everyone can safely access testing and the care they need. So please don't delay. Thank you. Merci.
We will now open the line to question. As usual, we'll do one follow-up. One question, one follow-up. We can start on the phone. Operator, over to you.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, veuillez appuyer sur étoile 1 maintenant pour poser une question. The first question is from Mike Blanchfield from the Canadian Press. Please go ahead.
Good afternoon, Dr. Tam. Has the CFL discussed their Winnipeg hub plan with you, and can you see a similar arrangement to the NHL for a modified quarantine as a way to get American players back in the country?
I think we can get back to you with the answer to that question. I'm not too familiar with the details, but the same principles would apply, I think, in the discussions concerning the CFL. And ensuring that the health and safety of Canadians are at the forefront, and that any protocols put in place are there to mitigate any kind of transmission to the general population. I do think that the kind of protocols that the NHL has in place, which includes the concept of quarantining the teams or cohorts, is something that is being addressed in that context. So, yes, I do believe that kind of concept sort of in discussion, but I don't have an update on that.
Your follow-up?
Yes, Dr. Tam, you did mention last week the great work of the Vaccine Task Force. Given the importance of finding a vaccine, I think Canadians might want to know more about this. So can you tell us more about it? Who is on it? How does it operate? And is it in a position to approve any new spending on vaccine research in the near future, soon, particularly the mRNA technology that we've discussed before?
Yes, so the Vaccine Task Force, I believe the information on the task force is available on the Government of Canada's website. The task force itself consists of experts that are independent outside of government. And they are people who've been experienced in the areas of vaccination, infectious disease, but also in the area of vaccine development and that sort of industry knowledge as well, I believe. They report to the two ministers of health and for ISED in industry and innovation. And so their role is to provide advice to the ministers. Ultimately, the spending and the how the money is spent is up to the government itself, but the task force will provide advice. And I think one can appreciate that with over 100 and probably 20 candidates right now globally, with quite a number of them being Canadian candidates as well. There's a lot of evolving information every single day. The task force, I think, is meeting 2 or 3 times a week just to review the ongoing evidence base in order to provide that advice. And I think the evidence is obviously on the trials and efficacy of the vaccine candidates and where they're in development, but also in consideration of accessing the international available opportunities, but also domestic manufacturing, and all of that is taken into account. I think the task force itself and the chairs of the task force will be able to provide more updates on how things are going, but I think the concept is that we need to consider a very broad range of approaches that includes getting us access, for example, collaboration with the international constructs like the COVAX initiative organized with the WHO so that Canada can have access to international candidates, as well as investments in entities like the ACT Accelerator, which is another construct that tries to bring vaccines to the fore. But needless to say, there's very active discussions with any promising candidate in terms of trying to get advanced purchasing agreements and those types of approaches done right now.
Thank you, Dr. Opper. Next question.
Thank you. The next question is from Ryan Tumulty from National Post. Please go ahead.
Yeah, Dr. Tam, you talked a little bit about the vaccine task force there. A lot of other major countries have purchased sort of pre-orders or pre-arrangements for some of the leading candidates of the vaccine, the Oxford one and the Pfizer one in the U.S. I'm wondering if you can talk a little bit about why Canada hasn't made such a pre-order yet.
Well, I think, as I've just said, there are quite a number of different candidates, and they're all being considered and evaluated. And there are active discussions right now going on with a whole range of manufacturers that have promising candidates, but I can't speak to you as to where those discussions have got to, but I expect that news will come from the Vaccine Task Force as they are ready to provide that, or the ministers responsible.
Thank you. Follow-up?
Yeah, I'm just wondering are you trying to figure out, I guess, in deciding which ones to potentially do a pre-order of, are you weighing, both the science of how effective they may be and where they're at in the trial process, but also about the potential economic cost of Canada getting a vaccine, 6 to 8 months after other major countries in the world?
I think all of the above factors are taken into account. Of course, the main objective is getting vaccines to Canadians as fast as possible that are safe and effective. And so all of what you just said has to be taken into account, as well as domestic capacity and what might Canada be able to do on the domestic front. Absolutely, access to those international innovations is part of that. So all of those discussions are being pursued.
Thank you, Doctor. Operator, one last question before we get to the room.
Thank you. The next question is from Marcy Cutler from CBC News. Please go ahead.
Hello. I understand that Health Canada has approved Remdesivir. I wanted to ask a question. That there was an issue around whether we have an adequate supply, and so I'd like you to address that if you can. Thank you.
Yeah. So Health Canada, they just provided a approval, I believe, with conditions on Remdesivir, which is a drug for the treatment of the more severe to the clinical presentations of COVID-19, so not for mild illnesses, but people hospitalized, need oxygen, or in the ICU. And so, and the approvals is accelerated in collaboration with getting data from other countries and their regulatory authorities, and whatever data is available. There'll be ongoing monitoring of the drug in terms of its effectiveness and safety as well. So not something that people can just sort of go out and access in by themselves, or even hospitals would be difficult. So the Public Health Agency is linking with the manufacturer to look at supplies. Quite frankly, though, supply is very limited globally from this company. So those discussions are taking place right now. I think the company will begin to accelerate its capacity, but the bottom line is that the supply is not plentiful. So we will do what we can to get some of the supply for Canada. There have been patients already accessing through the previous mechanism, special access programs, and there are 2 clinical trials that have been approved for Remdesivir in Canada. So I would like to, of course, see some updates from those trials as well.
And follow-up?
Yes, one more. There also was a question about the cost of Remdesivir. How is that being addressed? We understand it could be a fairly expensive drug.
As in any other drug, I think if we are trying to access the drug, it will undergo the appropriate reviews in terms of the pricing. But I can't speak too much about that or where that's going at the moment. But I am aware that some of these medications and drugs are going to cost a fair amount of money. But I think in the negotiation kind of processes. You have to sort of look at access as well as what's a reasonable price. So all of that will be taken into account.
Well, thank you, Doctor. We'll now turn to the room.
Thank you.
CTV News.
Hi, Dr. Tam. Rachel Haynes from CTV National News. I have a question as well about the drug Remdesivir. Are you hearing about any kind of adverse reactions to the drug when you are talking about these clinical trials?
I am not privy to any of the results of the clinical trials because they're ongoing. So I don't know that, I think the regulatory authorities or the people doing the clinical trials is part of the trial is that you don't kind of just suddenly release results without having analyzed them and got enough information. So I don't know about that. But I do believe that some of the range of side effects could involve other organs such as the liver and others. I think Health Canada has actually reviewed all of this information and determined that the benefits outweigh the risk of the side effects. But again, this is not a drug that you use as an outpatient. You have to be in a hospital setting where someone can monitor all of that. And if you are seriously ill from COVID-19, you may actually have compromise in your multiple organ systems and how you metabolize drugs. So that's why I think this drug should be used under those contexts of close monitoring.
And yesterday, Dr. Hinshaw in Alberta said that the curve is no longer flattening there. What kind of impact do you see overall nationally about the curve? We had talked many months ago about how the need to flatten it is so important. Where are we now, and are the surges that we're seeing over the last couple of days affecting the curve nationally?
Overall, yes, there is an uptick in the national curve, which is a composite of all the provincial ones added together. But the activity are, very different across the different jurisdictions. But with an upswing being seen in some of the western provinces, the sort of national curve does have a upward sort of direction to it, and which is why I said that this is a worrisome sign. It is different depending on local jurisdiction, but the fate of the flattening of the curve is still within each of our hands. And if we don't follow public health measures, have giant parties or crowds, or not observing sort of physical distancing or masking or hand hygiene, all of those things, when you're in certain environments, then you are going to see this uptick. What we emphasized was that provinces and local jurisdiction will tailor their public health response, tighten or loosen measures by looking at the activity in their environment. They will try as hard as they can to not go backwards, but if they're seeing things going in the wrong direction, they're going to course correct, as you have seen in some of the jurisdictions in British Columbia or others saying, in bars, you're not going up to get your drinks, no dancing, no mixing around, you're sitting down, having your meal, socially or physically distancing. So that has to be adjusted. The concept being that we will try and reopen the social economic space as much as possible because we know there's negative impacts. But at the same time, forewarning everybody that if people don't collaborate and support this effort, things could be tightened up again, and that is not, where we want. But just to reemphasize that certain of these environments and the risks that they're posing to those jurisdictions, including Alberta, are avoidable. And so that's the really key message. I know we have a long weekend coming up too. And that is, the Canada Day long weekend may have resulted in some big parties in certain areas of the country. They're social gatherings that have accelerated the cases. So far, the chief medical officers have indicated they are managing those outbreaks, but the more outbreaks you have, the bigger the public health capacity is being sort of utilized. And so that is not a good sign. So we need to sort of make sure we take this seriously and see that curve bend back down again.
And I do have one last question. A lot of the discussion that people have been having over the past couple of days have been about whether or not bars and restaurants should open. We did put a question to Dr. New a few weeks ago about whether or not he would feel comfortable going to a patio or going inside a bar restaurant. And I ask you the same question. Would you feel comfortable having a drink on a patio or having a meal inside of a restaurant?
So I think pubs, bars, restaurants are meant to have plans that they've submitted to local public health that they're following. I think, I'll talk about my personal sort of approach in a second. But if I was sitting in my home and about to go out the front door, first of all, I'll sort of evaluate my own risk, whether I'm someone who's at high risk of serious complications for COVID-19, because I'm not going to take a risk if that is the case. And especially in environments where I can't control the other people that are going in the environment. So if you were having a sort of gathering where you know that can be controlled, you know the people involved are going to do the right thing, that's something else. And maybe phone ahead to do a bit of research on that setting to see if that is going to be the case. If, I've had friends that said, well, I just looked through the window of the pub, it didn't look good, I'm not going in, I'm staying on the outside. So you may have to actually assess the situation as you approach it, because depending on your risk, you may not want to take the chance. And in an environment where you think is going to be unpredictable, you're going to take additional measures, such as absolutely wear that mask, because you don't know if someone else is going to impinge in your sort of physical space, and if the virus is in your community. So personally, I have to say that I have not ventured out at all, partly because of my work, but I go to the grocery store with my mask on and very infrequently. I haven't seen what the scene looks like, but I would probably be comfortable on the outside right now because outside is better than inside. But I would look carefully and see what on earth is going on inside the environment. If that doesn't look good, then I'm not going to go in.
Thank you, Dr. Tam. We'll now turn back to the phone for 2 more questions. Operator?
Thank you. The next question is from Tessie Sanchi from Hill Times Research. Please go ahead.
Hi. My question would actually depend on whether Minister Haidu was at the press conference.
Minister Haidu is not at the press conference. We only have Dr. Tam here.
Oh. All right. Then I'm going to let the next caller take my question. Thank you.
Thank you. Operator, next question.
Thank you. The next question is from Julie Gordon from Reuters. Please go ahead.
Hello there. Thanks for taking my question. We're just wondering if you're working with the provinces to contain the outbreaks on the Hutterite colonies and how concerned you are that there could be spread from these insular communities into sort of the broader public through their various activities like farmers markets and farm community work.
So, absolutely in terms of looking at hotspots, one of the things we've been doing is when we see these kind of outbreaks, immediately contact the provinces to see if there's any support that's required. In these community outbreaks, what we've been doing is, because more than one province is experiencing similar outbreaks, have been trying to coordinate the sharing of information and what's going on and the response. I do know that local public health and people on the ground have been trying to engage communities and their leadership, because gaining the trust of the communities and trying to explain what's going on and the importance of getting outbreaks under control is really important. And so all of that is going on the ground. What we are providing support for as needed is the epidemiological support. And right now, we haven't been asked to, for example, provide surge laboratory capacity or contact tracing in the context of these communities because it's being managed within the local context. But that's some of the assistance that we can provide in rapid order. We have the concept of maybe rapid response teams that can go in and help contain as needed. But so far that has, we provided, I believe, epidemiologic capacity.
Thank you, Doctor. Follow-up?
And are you concerned about how you would continue to respond and contain the specific sort of series of outbreaks without stigmatizing a whole group that actually already faces prejudices for its religious and community beliefs?
That's been a very important aspect of the response so far to date in many different contexts is, in fact, COVID-19 does not discriminate. This virus can affect any one of us. And so it's systems, it's society that discriminates and not the virus itself. So the important thing is that we encourage people to get tested, to know that any of us can be affected by the virus, and so that we gain the trust. One of the most important aspects of the pandemic response in Canada is the public, getting together and supporting the public health measures. So we need to do better with certain communities, and absolutely, the surrounding communities or the rest of the population should not stigmatize these communities. It does not help with any of the response. And so I do believe that some of the communities are taking leadership and, in fact, not only reducing spread to the communities around them, but within their own communities by restricting some of the movements between the communities themselves as well. So they are beginning to do that. But I do think it's quite a complex situation on the ground that people have to be mindful of, be patient and be supportive.
Thank you, Doctor. That will be all for today's press conference. C'est ce qui m'a fait la conférence de presse pour aujourd'hui. Merci.
Thank you. Merci. The conference has now ended.